Okay, you start strong and everything seems fine, then halfway through, it fades. And you can feel it happening, and the more you think about it, the worse it gets. And if that sounds familiar, stay with me. Because in many men, there's a real mechanism that's taking place here. There's a reason why it's happening. And a lot of people will call it venous leak. But the more accurate term is veno-occlusive dysfunction. And once you understand that, the problem starts to make a lot more sense. My name's Tom Pulice. I'm with Las Vegas Aesthetics. I work with men on vascular and sexual health concerns, and one of the most common things I hear is this: I can still get started, I just can't maintain it to the way that I used to. And that pattern can be consistent with a blood flow trapping problem. Not always, but very often it's the major part of the story. Here's the simple version. An erection has to do two things. Blood flow has to come in. That's what the pill helps with, but the blood has to stay there long enough to maintain the firmness. The pill doesn't help with that. In a normal situation, blood enters the erectile tissue. Okay, the tissue expands, the pressure builds, and the veins are compressed enough to help trap the blood inside. Oddly enough, you think of a sausage, how all the insides packed in there tight against the outer skin. If there was less in there, it would deflate almost, correct? That's not what we want. But this trapping effect is what helps maintain the rigidity. But in some men, that mechanism becomes less efficient. So the blood may come in well enough to get started, but it doesn't stay trapped the way it should. And that's why firmness starts to fade. Another way of thinking about this is you think of a sink, right? You crank up the faucet and the faucet's on, and the stopper seals tightly, okay? And the sink fills and it stays full. But if the stopper doesn't completely seal, water still goes in, it just keeps draining out at the same time. The sink never stays as full as it should. You think about like you're filling a bucket with holes in it. It's never really gonna work that well. And that's what this could be like clinically. Sometimes the issue is not just blood getting in. Sometimes the issue is keeping it there. And that's why so many men say, I can start, I just can't maintain. What the heck is going on? That does not mean every case is a venous leak issue. Erectile dysfunction could be multifactorial. Stress can matter. Performance anxiety can be huge in a guy. Hormones can matter. Medications, cardiovascular health, metabolic issues, pelvic floor function, all of it matters. But for many men, there's also a real vascular mechanics component to it. So what do you do about it? I think about this in 3 layers. Layer number 1 is what you could do right away. Layer 2, physical support. Layer 3 is clinical restoration. But let's start with layer number 1. First, reduce alcohol. And alcohol can impair nerve signaling. It reduces erection quality, and it makes it harder to maintain the blood flow dynamics that you may very well need. So if maintenance is already an issue, alcohol is going to make it worse. Second, you reduce the physical strain and overexertion. Some men do better when they're less tense, less physically strained, and less focused on how they're doing every second. Why is this? Because once adrenaline goes up, blood flow often goes down. And that brings me to point number 3. You break the mental spiral. And this is huge in men. A man starts to feel a loss of firmness. Then he notices it and he panics about it, and then adrenaline rises. And now a mild vascular issue gets amplified by the nervous system. So one of the most important immediate strategies is this: stop monitoring yourself every second. Shift away from performance and back towards sensation and breathing and relaxation and connection. And those things alone can help men interrupt that cycle. You break that cycle. So layer number 2, physical support. For some men, pelvic floor training can help improve erection quality and maintenance. The muscles that help support rigidity and control. And let me tell you, it's not magical, and they're not the whole answer, but in the right patient, they matter a whole lot. And a simple exercise to start is this. You tighten the same muscles you'd use to stop urine midstream. You clamp and you hold it for 5 seconds, you relax for 5, hold it for 5, relax it for 5. You repeat it 10 times and you do this 2 times a day. The key is consistency. You're not overdoing it. You're just doing controlled repeated contractions correctly. And some men will notice improvement over several weeks when they stick with it. And that's the important part. The other part of the layer too is pre-performance blood flow warm-up. And in selected patients, a quality medical grade vacuum device used appropriately before sexual activity may help draw blood into the tissue and prepare the area before performance, like you're warming up before a workout. That's what it is. You're warming it up. It's not a gimmick, not a standalone cure by any means, but it's a useful part of the strategy for the right person. Now let's talk about layer number 3, clinical restoration. And this is where we move beyond guesswork and look at the underlying contributors more seriously. At our clinic, depending on the patient, we may use therapies aimed at supporting blood flow and tissue health and overall erectile performance, and that may include acoustic wave therapy and PRP-based protocols. And there's combination approaches depending on what the patient actually needs. And I want to say something about PRP that's rather important. In my own clinical experience, PRP-based protocols have been one of the most valuable tools we use for the right patient. And I've performed countless numbers of procedures over many, many years on people from all over the world. And I've seen meaningful real-world benefit in properly selected men. Now, at the same time, broader medical guidelines still tend to describe PRP as this evolving regenerative therapy that's not yet fully standardized. And the weird thing is both of these things can be true at the same time. A therapy can be very valuable in experienced hands and still not yet be fully standardized in the broader guidelines. So I'm not trying to oversell it, and I'm not going to dismiss it. At the same time, what I've seen clinically, in the right setting, with the right evaluation, PRP can be a very important part of the broader restoration strategy, especially using the right amount, 120 cc's or more, no less than that. But the key is not guessing. The key is matching the plan to the problem. The 3 biggest mistakes I see are simple. Mistake number 1, men only address one layer. They'll rely on the little pill alone, and the pill can absolutely help men, but if there's an underlying blood trapping issue, a pill may improve the inflow, but it's not going to fully solve the maintenance problem. Your drain is still open, if that makes sense. Mistake number 2, they self-treat without understanding the mechanism. They assume all erection problems are the same. They are not by any means. Some are more vascular, some are neurologic, some are psychogenic, and many of these issues are mixed problems. Mistake number 3, they wait too long to look into it. And it's not because every case rapidly gets worse. It's more because the earlier you understand what's driving the problem, the sooner you can address it intelligently. And if what I described in this video sounds familiar, reach out to me or my team at Las Vegas Aesthetics. Schedule a confidential consultation. It's about clarity. We'll help you think through the 3 layers, what you can do immediately, what physical support may help, and whether you may be a candidate for a more structured treatment plan. There's no guessing, there's no gimmicks, there's no one-size-fits-all approach. It's just a real conversation about what may actually help you. And if this video actually helped you understand what may be happening in your own body, subscribe to the channel, hit the little bell over there. I'm building this channel for men who want straightforward, clinically grounded information without the fluff. And if you have questions, put them in the comments. I read every single one of them, and if they will help shape the future videos that I create. My name's Tom Pulice. I'm of Las Vegas Aesthetics. Thanks for watching, and I'll see you guys in the next video. Take care.